The Ministry of Public Health has the imperative task of providing the populace with quality and timely health care, and as such, the role of procurement was considered to be vital. In July 2017, the Procurement Department was established and it began addressing the challenges in Guyana faced by the healthcare system. It is no secret that the Ministry of Public Health has had its fair share of troubles as it pertains to their procurement practices.
To help fulfill the ministry's vision, the role of the procurement was deemed critical. With the establishment of the new Procurement Department in July 2017, the Public Health Minister set about tackling the madre of damning challenges it was facing. It deliberately broadened the procurement to pursue opening tendering, restrictive tendering, single sourcing, request for quotation, and request for proposal except for community participation. Consequently, the existing procurement process is much fairer, more competitive, and unquestionably more transparent.
Permanent Secretary of the Ministry of Public Health, Colette Adams, said, data obtained from a 12-day study of the Ministry of Public Health procurement system revealed that the ministry is at a level 2 of the 5-tier system. Martin Ellis, the procurement specialist hired by USAID, explained to the media that Guyana's achievement of a bronze status for procurement practices is something to be proud about. If Guyana is to be lifted to the silver status, there must be in place further advanced staff qualifications, introduction of standard operating procedures, and improved technology, according to Ellis.
In terms of the development of the country, the supply chains, etc., bronze is good. Bronze, you should applaud yourselves that you've got to that level. I was working with some very passionate, great people in December who want to do a fantastic job. The only thing that's holding them back is that they need certain knowledge in training and processes and some technology as well to be able to do that. So that's what they were the things that we identified and we put into this 9-project program. But certainly, if this is hinging on passion, you've got no problem because these people were professional and passionate.
Ms. Adams said throughout the course of this year, the Procurement Department will focus on continuing to improve the skill set of its staff and additional training by USAID experts in multiple areas, including standard operating procedures, implementing the procurement tracking system, software, and implementing steps to develop collaboration between the procurement and the material management unit.
The Ministry of Public Health also encouraged vaccines available to cater for high volume of neighboring Venezuelans seeking assistance in our country. The risk of imported measles is real, and to respond to this imminent threat, Guyana collaboration with its technical partners, PAHO, WHO, to increase vaccination coverage along its border and among most vulnerable groups. We have formulated an action plan which includes additional vaccine, cold chain security, HR, and transportation needs, while conducting surveillance and providing daily reports. The action plan developed focused only on childhood immunizations, but across all of the lifestyle cycles, which means protecting the adolescents, the young adult, and the elderly. Special emphasis was placed on ensuring that all migrants were screened or relevant vaccines and vaccinated from evidence was lacking.
In the quest to better the lives of Guyanese, there will be a stronger protection against vector-borne diseases like malaria in interior locations like Region 1, 7, 8, and 9. Special emphasis was placed on ensuring all migrants were screened for relevant vaccines, and when insubstantial evidence was presented, they were vaccinated. The ministry also called for strengthened public-private partnerships as well as greater ownership in the rollout of all malaria activities at the community and regional levels. Amel Griffith, HGP Nightly News.